This is the first in a series of presentations on the topic of disorders affecting the joints in veterinary patients. Be sure you keep reviewing the normal structures and normal appearance of bones as you continue to identify alterations in the normal radiographic signs as we continue through our topics. The intent of this presentation is to describe and provide examples of degenerative joint disease in the veterinary patient, and by the end of the presentation, you should be able to identify and describe the radiographic findings of DJD in the dog, cat, and horse. There are many potential joint disorders you may encounter that can lead to degenerative joint disease, so starting with identifying this process on radiographs is truly relevant. The following lectures will focus on the underlying disorders that lead to these more chronic changes. Degenerative joint disease, DJD, is the most common type of arthropathy identified in veterinary patients and is most often secondary to underlying issues such as soft tissue degenerative disorders, trauma, orthopedic developmental disease, conformational abnormalities, or even just kind of wear and tear as a patient ages. Other terms used include secondary joint disease, osteoarthritis, osteoarthrosis, and arthritis. I've bolded osteoarthritis because I will use the terms DJD and OA, or osteoarthritis, interchangeably. You should learn more about this and how terms can be applied when you review your orthopedic lectures. I want to start with just some terms and definitions because we'll use those throughout the remainder of our presentations. The term osteophyte is a very nonspecific term that typically refers to periosteoreaction or bone proliferation that occurs in the periarticular region or around the joint margins, and we use that when we're talking about degenerative joint disease. The term enthesophyte is a specific term, and that refers to periosteoreaction or bone proliferation that occurs at origins or insertions of joint capsules, ligaments, and tendons, and we will use that in some of the disorders that we look at. And then our final term I have talked about before, but that is the subchondral bone, and that is our compact layer of bone that is just below the articular cartilage. Remember, we don't see the articular cartilage because that is soft tissue opacity, and so it will look like the other soft tissues of the joint. And the subchondral bone appears on a radiograph as a fairly thin, uniform, dense region of bone opacity. So let's start out just talking about the radiographic findings that we might see in degenerative joint disease. The list here is not always seen in every patient, but are all of the potential things that we can see. So our radiographic findings will include osteophytes, and again, osteophytes are these usually non-aggressive looking, right? So smoothly marginated, distinct, fairly opaque bone that occurs at the margins of joints. So osteophytes here on the talus, osteophytes here on the calcaneus. We may be able to identify that the subchondral bone is thicker than it should be from sclerosis. And remember, sclerosis is increased bone opacity that happens within the bone. Okay, so periosteoreactions on the outside cortex and sclerosis on the inside. So in this patient, we see some increased bone opacity here, where that subchondral bone should just be a thin layer of opaque bone. So for example, on this base of this calcaneus, this thin region of bone would be our normal subchondral bone. In some patients, we will actually see areas that look lucent or lytic, that are subchondral bone erosions and cystic lucencies. Those typically are in more advanced cases of degenerative joint disease and happen a lot more in horses. Then, of course, usually the synovium and the joint fluid is increased, and so we will oftentimes have some degree of joint swelling that will be centered around that joint. So this patient has a little bit harder to see, but soft tissue swelling centered at that tarsocrural joint. So that is our joint swelling. As the articular cartilage becomes involved, it can get eroded, and so we can actually look like we have joint space narrowing. We do have to be careful about calling narrowing on radiographs, especially when the patient is not weight-bearing, because that can be an artifact of positioning. And then that term enthesophytes is that new bone formation or periosteoreaction at insertions of things. And so in this case here we have some bone proliferation that is at the level of the medial malleolus, and that is enthesopathy, probably at the origin of the collateral ligament here. So maybe this patient had some damage to that collateral ligament, or we could see some of this non-aggressive looking periosteal reaction where the joint capsule is attaching. And then we may be able to see what some people will refer to as joint mice. And joint mice, that's a nonspecific term. Those are osteochondral fragments that are in and around joints. They may be fragments from developmental disorders. We'll see in another couple presentations. They may be from trauma or little avulsions, so little pieces of bone that are broken off, or even our soft tissues. Remember, when they get devitalized, dead, and damaged, they can have dystrophic mineralization. So here's that same patient that just has further labeling of the structures that are the intracapsular or joint soft tissue swelling, the osteophytes on several of the bones, the enthesophyte at that medial collateral ligament, and then some sclerosis of the subchondral bone. And then this patient actually has most of his arthritis secondary to a developmental disorder and likely some previous trauma. Here's just another example. This last patient was the tarsus. This is the carpus. This patient has very localized changes here to the medial aspect of the carpometacarpal joint, where there are, fairly large but smoothly marginated osteophytes, which is that periarticular periosteal reaction that is at the level of this carpometacarpal joint. And then this is an example of some true joint space narrowing. We can compare that to the rest of the joint space that is a little bit wider and uniform all the way across. So this patient likely had trauma to this medial aspect of this carpus. Here's an example of a horse. These are the phalanges, and this patient has very advanced degenerative joint disease. And in this patient, the additional findings that we can see are these subchondral erosions, or basically it is lysis, but subchondral erosions that are on either side of this proximal interphalangeal joint. There is quite a bit of sclerosis along the subchondral bone of this middle phalanx at the proximal part, and even of this proximal phalanx at the distal part. This patient also has some osteophytes. This is true joint space narrowing. So in the horse, when the horse is weight bearing, which this horse is, we can be more confident about identifying joint space narrowing, especially when we compare this proximal interphalangeal joint and how it's very narrowed on this side compared to the other side to the more uniform space of the distal interphalangeal joint. So that can help us. These are two different joints with some degenerative disease. The image on the left is of a close-up view of the left coxfemoral joint in a dog that has hip dysplasia. And these are osteophytes along the cranial margin of the acetabulum. This dog has probably some true joint space narrowing. And then part of this opacity is actually the dorsal rim of the acetabulum superimposed over the femoral head, although the femoral head is abnormal. But here are some cystic or subchondral lucencies in the femoral head and neck. And many times what these subchondral lucencies are secondary to is kind of proliferation of the synovium that then can kind of push into and cause some regional reaction to the bones of that joint. This is a lateral view of a tarsus in a dog, and this is a fairly common site of what is probably just kind of aging wear and tear. And if you look at his distal intertarsal joint here, compared to the proximal intertarsal joint at the dorsal aspect, all of this is periarticular osteophytes on the dorsal margin of that distal intertarsal joint. Here's an example of a cat, and cats certainly get degenerative joint disease as well. And in fact, in cats, especially, it seems like their shoulders, their elbows, and their stifles, they get a lot of these kind of periarticular ossified bodies. So again, the nonspecific term would be joint mice. If you look at this lateral view of the elbow, several of these round mineralized structures are actually separate from the bone. There's some additional osteophyte formation along the distal humerus that we can see here on the medial and the lateral aspect. But again, some of these nice round oval structures are separate ossified bodies. And when you see this many of them, there is a name that we can put on it, which is synovial osteochondromatosis, and so those are actually ossified bodies that are forming in the synovium. For certain joints in the horse, we should be familiar with some layman's terms for the degenerative joint disease. The horse phalanges, both the proximal and distal interphalangeal joints, when they have degenerative joint disease, the layman's term for that is ring bone. The term high ring bone will apply to arthritis of the proximal interphalangeal joint, and low ring bone will apply to arthritis of the distal interphalangeal joint. The term bone spavin applies to degenerative joint disease or osteoarthritis of the tarsus. This is an example of a horse with high ring bone, or more accurately, we'll use the terms degenerative joint disease of the proximal interphalangeal joint. We have a lateral and a DP view, and we can see that this horse has pretty severe degenerative joint disease, very large and severe osteophytes on the dorsal aspect of the joint space here. Again, distal part of the proximal phalanx and proximal part of the distal phalanx. Some of this goes down into the mid-diaphysis, and a lot of times that's enthesopathy at the capsular attachments. When we look at the dorsal palmar view of this patient, like the earlier example, has specific narrowing here of this part of the proximal interphalangeal joint with subchondral sclerosis and a lot of these subchondral lucencies. And the subchondral lucencies are pretty common in horses. Also has some osteophytes at this side of the distal part of the proximal phalanx, as well as some maybe separate mineral opacity here that might be some dystrophic mineralization. Here's an example of low ring bone or degenerative joint disease of the distal interphalangeal joint. This joint typically has less severity when we compare it to the arthritis that happens at the proximal interphalangeal joint. So in this patient, we can see some smoothly marginated osteophytes that are forming on the dorsal margin of the distal part of the middle phalanx. There's also some smoothly marginated periosteal reaction on the mid-body, and this is enthesopathy at the origin of these collateral ligaments that are for the distal interphalangeal joint. So this is more of a moderate amount of degenerative joint disease. On the palmar aspect, this patient also has some mineralization here that is separate from the middle phalanx. This is most likely dystrophic mineralization that is in either a ligament, which could be like the suspensory ligament of the navicular bone, or within a tendon like the deep digital flexor tendon. This is important for you to remember. In the equine tarsus, degenerative joint disease most commonly affects the distal intertarsal and the tarsal metatarsal joints. And why it's important to remember this is that when you start evaluating the tarsus for the cause of lameness, if you remember the types of diseases that can cause the lameness and then where to look for them, it will benefit you when you make diagnoses. This is a normal lateral view of a tarsus, just reminding you we have the tarsocrural joint, the proximal intertarsal, the distal intertarsal, and the tarsal metatarsal joints. And most horses will get their degenerative joint disease in these distal two joints. It is important to know that there is poor correlation of the radiographic appearance of DJD with the clinical signs. So very small or mild radiographic changes can be quite significant clinically. Here's an example of a patient. I have a lateral and a DMPLO view of the same patient. And this patient has very mild osteoarthritis of the distal intertarsal and tarsal metatarsal joints. Very small irregularities, and again, pretty minor, and this horse is actually lame, so small irregularities at the dorsal aspect of both of those joints, a little bit more irregularity here on the third metatarsal bone. These are, again, termed osteophytes. Joint spaces look okay, and I don't see any other changes. Then on the dorsolateral side, we can see a little bit of those changes as well. So pretty mild. We don't usually see much for joint swelling in these low motion joints. Here's a different patient that has more advanced degenerative joint disease. This is the DP and the DLPMO view. And when we assess this patient's distal intertarsal joint, I look across the joint and see that it is open here and starting to narrow here. When I see that in one view, I want to see if that's true in another view in order to make sure that it's not an artifact of beam angulation. And we can see that it is narrowed in this other view as well. Then when I look out at this dorsomedial side, notice there are these subchondral erosions that are centered on that distal intertarsal joint. The other finding this patient has is sclerosis throughout this portion of the central tarsal bone, as well as sclerosis throughout this portion of the third tarsal bone. If you look at the more plantar lateral aspect of this third tarsal bone, this is what the normal bone should look like. We should have a more lucent medullary region, and then the subchondral bone is the more compact bone. So quite a bit of sclerosis. And then here's a patient that has basically kind of almost healed his severe degenerative joint disease. So we have a lateral and a DMPL view. Notice that the distal intertarsal joint is pretty much completely collapsed, and in fact it seems to be bridged, especially here at this dorsal and dorsolateral aspect with new bone. And when we see this, that basically means that joint has fused. In this patient, I think it's entirely, and the word we use for fusion of a joint is ankylosis. And this is more likely to occur in low motion joints. This patient has very mild osteophytes, I believe, here at the tarsometatarsal joint as well. Notice this central and third tarsal bones are just diffusely sclerotic as well. Certainly you can look at these readings that I have listed here for you to find some more explanation as well as additional examples to look at the degenerative joint disease as it appears in small and large animals, and be sure that you use the index in the textbooks to find an area of interest to further read on.